Hello friends. Today I am going to discuss very high yield topics in this video. Mainly this video is about alcohol and drug addiction, but because there are a few more stations or scenarios which are interlinked, and basically all of these have same structure to follow. So that's why I decided to make a video to combine all those scenarios in one video so that it becomes easier to remember the things, to remember the approach about these 6 stations. This is a very high yield video, and please watch it till end because you will be able to cover many scenarios in your Plab 2 examination by watching this presentation. And I try to make it easy to understand, easy to digest, and easy to memorize. And all the information are up to date and relevant to the current guidelines. So let's start. The topics which I am going to discuss in this video are high yield topics. Most commonly, these come in Plab 2 examination. Number one is alcohol dependence. Second one, drug addiction. These problems are very common in Western societies, and you must know these topics in and out. Third one is a colleague with alcohol issue. Fourth is colleague with cocaine issue. Fifth one is colleague coming late. And the last one is colleague posted a patient's information on the Facebook. So you will feel it strange at the moment why these are interlinked, but as you will go through this video, you will realize that why these are very similar stations. So let's start our first topic, an approach to alcohol dependence. Safe recommended allowance for alcohol is 14 units per week for both male and female, and not more than 2 to 3 units a day with 1 to 2 days off. Key points about this scenario, about this station, is that you should be honest and non-judgmental, and you should never criticize or blame the patient. Do not start your consultation by discussing alcohol directly. For example, if you want to discuss with a patient about any problems which patient is having, you want to tell the patient that it is related to patient's alcohol consumption. So talk about different things and then come to the topic of alcohol, excessive alcohol consumption and reducing its amount or stopping it. Remember that many patients drink in secret and may not want to discuss the issue. And if a patient denies drinking alcohol, then you can offer confidentiality, that whatever we will discuss today will remain in the healthcare system. It is also very important that the patient needs to realize that there is a problem. Patient should have an insight before any therapy for alcohol dependence can be started. When you are dealing with alcohol dependence issue, do not forget asking about the consequences of excessive alcohol consumption. For example, on family and relationships, finances, and legal matters. And also do not forget to ask questions about complications which excessive alcohol consumption can cause. It is also very important to ask about alcohol withdrawal symptoms because these symptoms suggest that this patient needs medicine to treat alcohol dependence. Alcohol withdrawal symptoms are anxiety, especially after waking up in the morning, sweating and tremors, nausea or retching in the morning, vomiting, hallucinations, and in severe cases, seizures or fits. So you need to ask about these withdrawal symptoms if patient has experienced these symptoms. For example, if patient tried to decrease or quit alcohol in the past. How to approach alcohol dependency cases? So first of all, determine drinking habits. Second is use cage screening tool or cage questionnaire. Then ask TDW questions. Then ask about famish questions. Take past medical history as usual and also ask about complications of alcohol consumption. Very important is to ask about driving and whether patient knows that his or her excess alcohol consumption can be unsafe for himself and for others. So check these driving issues. Sometimes Plab 2 candidates they forget to perform examination or mention examination in alcohol dependency uh, cases or stations. So it is very important to mention examination. Then give your assessment about whether patient is dependent or has dependency issue, or patient can be treated in the community, or patient needs inpatient detoxification. And next is management. So in this way you can go through this station. So you need to remember these steps. You can see that I have crossed A in famish questions because this is alcohol dependency station. So A stands for alcohol. I crossed it and put D instead, which means that instead of alcohol you need to ask about drug abuse. So D is for drug abuse. I will discuss it later. So first step, determining drinking habits. So you need to ask, what do you drink? Wine, beer, spirit, what kind of alcohol patient takes usually? Then how much do you drink? If patient says not much, then explore further. Ask, since when have you been drinking? Ask the patient, give me a rough estimate of how much you drink in a day or in a week approximately. Then you can further ask, how much did you drink during the last week before you came into the hospital? Another important thing is to ask, has it always been this much or you have increased the amount recently? And then another important question, may I ask, is there any particular reason for drinking alcohol above the recommended safe limit? I mean, do you have any kind of stress in life, or if you do not have the same relaxation with the amount which you previously used to consume, and that's why you are increasing this amount. Also important to ask about where patient drinks, usually at home, in the bar with friends, and ask the patient, do you have any idea about the safe limit of alcohol consumption? So these are determining drinking habits. Next come cage questionnaire and TDW questions. Cage screening tool is used to see whether patient is dependent or not, and it consists of 4 questions. First question is about cutting down. Have you ever felt that you should cut down on your drinking? How do you feel when people talk about your alcohol habit? If patient feels annoyed, this is also 1 score. Third is, have you ever felt bad about your drinking habit? If patient says yes, I feel ashamed or I feel guilty, then this is also a score. It is better not to use word guilty when asking question from the patient. Next question is about eye opener. Have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover? So these are the 4 questions: cut down, annoyed, guilty, and eye opener. And scoring criteria is 2 or more correlate with substance abuse, I mean alcohol abuse. Then TDW questions are to further clarify. For example, tolerance. Ask, do you have to increase the amount of your alcohol intake to get the same feeling? For dependence, do you think not having alcohol affects your daily activity? If patient says yes, then it indicates that patient is dependent on alcohol. And then withdrawal, as I mentioned earlier, that do you experience any side effects or bad symptoms if you don't drink alcohol for some time. So this was the second step. Coming to famish questions. So famish questions are routine questions. You need to ask about family, friends, finances, and forensic or trouble with law. Then, as I mentioned earlier, I crossed alcohol because this station is in itself is a alcohol station. So you need about other recreational drugs if patient is taking any. M for mood, any medication or mental health issues. Next is insight, and S for suicidal thoughts, and H for hallucinations. So I will go through these questions one by one. So you can ask these questions: who do you live with? How do you get on with them? Any kids? Do they live nearby, or do you live with your partner or your kids? Any other relatives who live nearby? Do you have any friends? How do you spend your time with your friends? What do you do for a living? Are your finances sorted? How are things at work? Do you drink after work at the workplace? Have you ever had any trouble with the law? Any recreational drugs you take, or do you smoke? So all these questions are to get information about the social situation, social triggers of the patient, and these are helpful in our management, making our management plan. Then you have to ask about mood. How has your mood been recently? This, and you can ask the patient to score his or her mood. Then insight. Do you think you need to cut down on your alcohol? If the patient says no, explain the harmful effects of excess alcohol. Then ask about self harm. Have you ever thought of hurting yourself? Ask about any other mental illness. Ask about hallucination or hearing voices, or seeing things which are not really there. All these help to know about the complication of alcohol or drug intake or abuse, and patients with mental health issue, they are more prone to take excess alcohol, and are more prone to drug abuse. In this station, you always take past medical history. Do you have any other medical illness? Are you taking any medications? Are you allergic to any medications? Any family history of, for example, cancer or any important significant illnesses? Then also ask about complications related to alcohol excess. So in this way, and take past medical history as usual, and ask about physical symptoms related to excessive alcohol consumption. Then, as I mentioned, you can ask about driving, because if drunk driving is an offense, and it is unsafe for the patient and for the public if someone drives under the influence of alcohol. After that, I mentioned that you need to examine and give your assessment. So examination mention that I would like to check your pulse, blood pressure, do a general physical examination, and examine your tummy, for example, for hepatomegaly. Then assessment, you can give your assessment to your patient that Mr. X, your alcohol consumption has been a bit off the recommended alcohol allowance limit, which is 14 unit, spread over the week. I agree that alcohol is not harmful if drunk in moderation. However, having a bottle of wine a day will have some effect on your body. Drinking too much over time can cause chronic physical and mental health issues, and it can cause or contribute to liver damage, cardiovascular disease, and multiple types of cancer, as well as it causes decline in mental abilities. And we are here to help you if you want, if you consider. So, after all this, we come to the plan of management, how to start management for alcohol dependence. I try to make it simple and up to date, because in different resources there are very confusing information. And I hope that after this video, you will have a clear concept about the management of alcohol addiction. So, for management, first of all, you need to determine a few things. First of all, ask the patient that if he has tried cutting down alcohol before on his own or with support of counseling groups such as Alcohol Anonymous, and was the attempt successful or not, and if unsuccessful, find out why it was failed. Were there severe withdrawal symptoms or any other factor? Also determine if patient has low mood or risk of self-harm, because in these cases you need further assessment and measures to be successful. Then ask about any underlying health issues or complications. Very important to confirm if patient is taking any other concomitant drug, recreational drug abuse. Then ask about family support system and identify triggers, family, occupation, friends, occupation, hobbies of the patient. And then you need to determine whether this patient can be treated in the community as outpatient, or patient needs inpatient detoxification and rehabilitation. So coming to alcohol detoxification plan, very important. So community based alcohol detoxification. Most people receive support to stop drinking and recovery support in the community through local alcohol detoxification service. If they need medicine to help stop drinking, it can often be taken at home or when attending a local service daily. In some cases, a short stay in a 24-hour medically supported unit can be recommended so they can receive safe treatment of their withdrawal symptoms or other problems. Third important thing is referral to self-help groups. There are also many free local support groups and other alcohol counseling services available. For example, self-help or mutual aid groups such as Alcohol Anonymous or Smart Recovery groups. We refer to these groups because apart from other measures and medications, patients need mental strength. They need a strong will, and these services, self-help groups, they give information and help and provide support to give that strength to the patient to successfully quit alcohol or drugs. So alcohol detoxification plan is continued. Apart from all other measures, we have to give lifestyle advice to our patient. For example, avoiding triggers or situations which can be tempting. For example, the friends who the patient drinks with, or seeing other people drinking, or going to the bar. In some cases, change of occupation may be required if possible. For example, working in a bar may make it difficult to quit drinking alcohol. Then advice about safe driving, and safety netting is also very important in this station, and people usually forget in their Plab 2 exam. Safety netting is that explain to the patient that during the period of cutting down, if you feel severe withdrawal symptoms or any other problem, then come to the hospital immediately. Now comes intensive alcohol rehabilitation. Intensive rehabilitation is needed for some people. They are assessed as needing intensive rehabilitation and recovery support for a period after they stop drinking completely, either through attending a program of intensive support in their local community or by attending a residential rehabilitation service. This type of intensive treatment is usually reserved for people with medium or high levels of alcohol dependence and those who have received other forms of help previously that have not been successful. Now, coming to treatment options for alcohol detoxification in detail. So, there are medical options and non medical options. Medical options are when someone has become physically dependent, stopping overnight or suddenly could be harmful, and these patients will need medicines to do this safely and gradually. So, to reduce the withdrawal symptoms such as agitation and hand shaking, patient can be given diazepam or chlordiazepam oxide. To reduce craving, a camprosate is given, which is called anti-craving. As a deterrent, disulfiram is used. It reacts with alcohol and leads to unpleasant symptoms like feeling sick, vomiting, dizziness, or chest discomfort. Then, to help reduce the amount of alcohol intake and prevent relapse, we use naltrexone or nalmefene. These work by blocking the receptors sensitive to alcohol, and these can be prescribed along with counseling and other therapies to reduce the amount of alcohol intake and also for preventing relapse. Coming to non-medical options, remember that cutting down or stopping drinking is usually just the beginning, and most people will need some degree of help or a long-term plan to stay in control or completely alcohol free. Only relying on family, friends, or carers for this often is not enough. Getting the right support is crucial to maintaining control in the future. So there are many longer term supports available, which I have discussed. These are self-help groups, Alcohol Anonymous and Smart Recovery Group. Alcohol Anonymous is a free self-help group. It's a 12-step program which involves getting sober with the help of regular support groups. You will be able to meet many people who successfully have stopped drinking now. Alcohol Anonymous will help you to realize the problem, motivate and assist you to find a solution for it. And smart recovery groups help people decide whether they have a problem. They build up an insight, then build up their motivation to change and offer a set of proven tools and techniques to support recovery. Other non-medical options are counseling service. Patient may be referred for one-to-one counseling, and then talking therapy, CBT. It will help you to get the mental strength and motivation you need to cut down alcohol. It helps you to identify the instigating event or factor which led you to alcohol dependence. It helps you identify the beliefs that may possibly be causing obstacles in quitting alcohol. For example, if you think I am not able to work without taking alcohol, so these CBT may offer counseling or therapy to address these beliefs because these are false beliefs. CBT also helps to identify the triggers and helps to set a motivational goal. Remember, you may not be asked to stop alcohol immediately. Instead, you will reduce gradually and then eventually stop. You will also be asked to record your alcohol intake regularly in an alcohol diary. This will help to show you and your therapist how well you are doing and how soon you will reach your target. And then family therapy. Involving your family in your treatment plan, if you wish to, will have a positive impact on you and will improve the efficiency of your treatment. Our colleagues can talk to your family about the problem and the approach we are taking towards solving it. So, this was all about alcohol dependence and detoxification and management. Next topic is approach to drug dependence. This is linked with the previous station because it has the same structure, same key points. Be honest, non-judgmental, never criticize or blame. Do not start consultation by discussing drug dependency issue directly. Many patients may not want to discuss the issue. If the patient denies drug abuse, you can offer confidentiality. Patient needs insight that there is a problem before therapy can be started. And do not forget asking about the consequences of drug dependence, for example, on family, relationship, finances, legal issues, and health complications of drug abuse. And never forget to ask about withdrawal symptoms that suggest a patient may need medicine. I will discuss approach. It is same again. Determine drug habits, cage screening tool, TDW questions, famish questions, past medical history and complications, driving, examination, assessment, and management. And you can see in famish questions, I have added plus D. Plus D shows that if patient is taking one drug, you have to ask whether he is taking other drugs, one or more drugs. So plus T signifies to that. Now coming to our opioid withdrawal symptoms like heroin, for example, a patient is taking heroin or morphine. Early symptoms typically begin in the first 24 hours after stopping the drug, and these include muscle pains, restlessness, anxiety, watery eyes, runny nose, excessive sweating, inability to speak, sleep, and yawning, which is very common. Later symptoms include these are more intense and begin after the first day or so and include diarrhea, abdominal cramping, goosebumps on the skin, nausea and vomiting, dilated pupils and possibly blurry vision, rapid heartbeat, high blood pressure, and withdrawal symptoms Although very intense, they usually begin to improve within 72 hours, and within a week, you should notice a significant decrease in the acute symptoms of opiate withdrawal. So, same plan of management. So, establish the drug pattern as we establish the alcohol drinking pattern. So, which drugs do you use? How much do you take? How often do you take? For how long have you been taking it? How much? How do you use it? Sniffing or injections? Where do you take drugs alone or with friends? Whether you are using any other drugs or alcohol? What your physical and mental health are like nowadays? What your personal circumstances are, for example, where you live and who you are living with, whether you have had treatment for drug before, and don't forget to identify triggers and asking about needle sharing and whether patient is aware of needle exchange program. And it is also important to test a urine sample to confirm that the patient is using heroin. Next, the same cage and TDW questions. Have you thought of cutting down or quitting? Why did you try to cut down before? Do you sometimes get annoyed when people talk about your habit of taking drugs? Do you feel bad when people, do you feel bad about your drug habits? Do you take them in the morning as well? Do you think that you have to take more and more drugs to get the same effect as before? Do you feel you cannot do your daily activities without taking drugs? And how do you feel when you do not take these drugs? So, these three questions are about tolerance, dependence, and withdrawal. And scoring is same. Two or more score correlate with substance abuse, and TDWP questions I have already discussed. Similarly, famish questions. Do you live with your family, partner, or kids? How is your relationship with them? Tell me about your friends. Do you take drugs when you are with your friends? Do you think this is affecting your health or social life or family life? Do you have friends? What do you do for a living? Patient usually says, I am on benefit or I am homeless. Ask the patient about legal issues at any point. Have you had any trouble with the law? And then ask about alcohol consumption and smoking. Ask about mood. Ask the patient to grade his or her mood. Then ask about triggers, for example, stress, which is making you to take drug, and ask about other mental health conditions in the past or present. At any point, thought of harming yourself or ending your life, and check inside. Do you think you need help, or do you think you have this issue of drugs? And how do you see about your future? Do you ever feel that someone is telling you to do things or controlling your mind? To check for thought abnormalities and check about hallucination. Do you ever see or hear things that other people seem unable to see or hear? So hallucinations are common with drug abuse. Check all these things, then take past medical history as usual. Do you have any medical condition? Are you allergic to any medication? Are you taking any medications over the counter or food supplement? Do you have a family history of any mental health condition? So these famish questions are almost same. Then examination is same. I would like to check your pulse, blood pressure, do a general physical examination, and examine your tummy. For example, for hepatomegaly, patient may be using alcohol as well. And assessment, if patient fulfills the criteria of dependence, you can give your assessment that according to my assessment, you have problem of drug abuse, and as you know, it is not good for health as well as for your social life. We can help you to quit the habit of taking drugs if you are willing to do so. Now, next step is how to start management for drug addiction. Same approach. First of all, determine has a patient tried quitting before on his own or with the help of self-help counseling groups such as Narcotic Anonymous. Was the attempt successful or not? If unsuccessful, find out why. Were there severe withdrawal symptoms, any risk of self harm, any underlying health issue or complications, concomitant another drug abuse or alcohol dependence, family support issues, and triggers, and where should be treated in the community or as inpatient. So, all the information which you have gathered, which I discussed in previous slides, all these will help to determine these things and make a management plan. So what is drug de-addiction plan? So management plan is that patient is assigned a narcotic key worker and outpatient de-addiction is option. In outpatient de-addiction, there are two types. One is maintenance therapy and second one is detox therapy. Then you also have to do safety netting for outpatient de-addiction. I will discuss how. And then next is inpatient detoxification and rehabilitation. I will also discuss other support which is available for drug de-addiction, and then I will discuss other important issues which you have to discuss with the patient. So this is the management plan. Assignment of a key worker. Tell the patient that you will be given a key worker who will help you put together a personalized treatment plan. You will meet him or her regularly throughout your treatment, and your key worker will help you decide between two different approaches to stop heroin. One is maintenance therapy and the other one is detox. Now, outpatient drug de-addiction for heroin. What is this? Outpatient drug de-addiction program is that its aim is to help you withdraw from heroin gradually and ease withdrawal symptoms. You will usually live at home. Detoxing from heroin while living at home can take up to 12 weeks. There are two options: maintenance therapy. Maintenance therapy is where you switch from heroin to a heroin substitute such as methadone or buprenorphine and then stay on a stable dose of the substitute. And the other option is detox. It is where you switch from heroin to a heroin substitute before gradually withdrawing from the substitute so that you are completely free from both. And there is a switching option. You can switch from maintenance therapy to detox at any time. Next is treatment for other drugs or alcohol dependence. Sometimes patient is taking other drugs as well or also is alcohol dependent. So you will be offered support with stopping these as well as an outpatient. Supervision is provided. Your daily dose of methadone or buprenorphine will be supervised by a drug worker or pharmacist for up to 3 months. And safety netting. What is safety netting? You need to tell the patient that during the period of detoxification, if you feel severe withdrawal symptoms or other problems, ask him to come to hospital immediately. And second safety netting is that be aware of the overdose risk because detox lowers your tolerance to heroin. This means your risk of overdosing is higher if you take heroin after detoxing. You have to inform the patient about this. Now, coming to inpatient detox and rehab. As a hospital inpatient or in residential rehab, this can be provided only if a patient needs medical help for other physical or mental health problems, or a patient needs to detox from alcohol or another drug such as benzodiazepines as well as heroin, and in those patients in which community detox has not worked before, and then for patients who have severe withdrawal symptoms. What is inpatient detoxification and rehabilitation? This is to give a medicine to help with the withdrawal side effects, which is lofexidine. Then patient experiences some withdrawal symptoms. These can be managed, for example, for anti-sickness medications, with medication for loose stools or diarrhea, and for medicine to control nervousness and racing of heart or palpitation. Patient also receives support for alcohol dependence and or other drug abuse as appropriate. So this is inpatient detox and rehabilitation. Now coming to other support for opioid addiction while you come off, these include talking therapies. You may be offered a talking therapy like CBT if you need help with anxiety or depression while you are detoxing. It can help you to understand and overcome your addiction problem, identify the false beliefs that may possibly cause the obstacle in quitting. For example, I am not able to work without taking drugs. Then identify the triggers and finding ways to avoid or eliminate triggers. Then referral to support groups. Your key worker will give you details of local self-help groups such as Narcotic Anonymous or Smart Recovery. There is also support available for family and carers. Your key worker can organize support for people close to you who are affected by your addiction and also give advice to patient to stay healthy. This includes advice on healthy eating and offer other tests for infections such as HIV and hepatitis B and C. Then tell about incentives which are available. For example, tell the patient you may be offered rewards such as vouchers or doses of methadone to take at home for sticking with your treatment and staying off heroin. All these are to motivate the patient and to improve his or her general health. There are some other important issues you need to address in drug addiction problem. These are about needle sharing and about explaining the patient about needle exchange program, where you can go to a pharmacy and give a used needle and get a new unused needle. If both the partners are taking drugs, then offer help for the other partner if he wishes to stop drug habit. And if they have children and both partners are drug addicts, you need to talk about the social services for the safety of the children, if applicable. Then give advice about lifestyle and triggers and explain what happens after detox. Tell the patient after detox, your key workers will carry on supporting you for up to 6 months to help you stay off heroin. This support may include help with issues such as housing or getting back into work or education. Right, so guys, this was all about alcohol and drug addiction. I know this lecture is going to be a bit longer, but I need to discuss 4 other stations because these have same structure, and if you keep listening to this video, you will find it very easy to manage these 6 stations for your exam. So coming to talking to a doctor colleague about his alcohol abuse issue. So I have devised a SIPES approach for this. SIPES approach, if you follow SIPES approach, then it is very easy to manage these stations. The rest of 4 stations, you will have to follow SIPES approach. What is SIPES approach? First of all, seek information, which includes confirm whether the issue is there or not. Then why the person is drinking, your colleague, why he's drinking alcohol in excess nowadays. For example, old habit or new habit, any stress, any problem with any issue with life, for example, breakup, or if patient is just celebrating something, then check mood and risk of self-harm and check insight and check whether he has tried to cut down or not. And then initiate, discuss patient safety, then escalate, and S is support. You will become familiar with these terms, and I will go to discuss and repeat these again and again. So please uh, bear with me and don't get annoyed if I repeat these again and again, because the purpose of repetition is that you will be able to remember these. So SIPES approach: S for seek information, I for initiate, P for patient safety, E for escalate, S for support. Now I'm going to go into details, but before that, important things in such scenarios where you have to confront your colleague, you need to keep in mind that first you have to have a good rapport. You need to build a good rapport, and you need to explain that you are concerned and you are there to help, not to judge or criticize. And then sometimes you need to offer confidentiality as well, and you don't forget to offer support. So I will go into these things in my next slides. So seeking information, in this case, when you are going to talk to your colleague about his alcohol problem, so you can start that: thanks for coming to have a chat with me on my request, and how's your day going, any problems so far, how's your life been in general. If he says not good, then explore what's the problem. May I ask what happened? If he tells something bad happened, such as loss of a loved one or a recent breakup, then show sympathy. I am very sorry that you are going through such a difficult period. Then you can ask that Mr. Mr. John or Mr. Smith, whatever his name is, that if you don't mind, I am here to discuss an important issue with you, and is it okay with you? And then you can say, could you please tell me how much you are drinking these days? He may ask why you are asking this. You can explain. I will go into that after a while. Then you need to ask how much did you used to drink before, and then at what time of the day do you usually drink, and have you been drinking in the morning before coming to work. If he asks why, then you can initiate that it is just that I am concerned about you, that's why I am here to talk to you, and I arranged this meeting because some people have noticed that you smelled alcohol a couple of times last week, and honestly speaking, many colleagues have also noticed the same thing this morning as well. and I am here to help you. And please be honest with me. Are you drinking in excess? Have you been drinking in the morning before coming to work? So this, and if he admits, then say thank you for having trust in me. So I appreciate that. Now, as I discuss, all the stations are linked. You can ask age and TDW questions. Briefly, you can ask, have you tried to cut down? And do you feel bad when people talk about your alcohol habit? Have you ever felt bad about your drinking habit? Have you ever had a drink first thing in the morning? These are just to check whether your colleague is alcohol dependent. And scoring system is same, two or more scores correlate with alcohol abuse. TDW question, I am not going to repeat these again and again. You can read on your own. Coming to next slide. Famish question, who home do you live with? Any close relative nearby? Do you have any support at the moment? Is there anyone who you can turn to during this difficult time? How would you describe your relationship with your family? How about your friends? And then can ask about, have you been taking any other substance to help yourself? Sometimes people, when they are in difficult time, they use like recreational drugs. And ask, how is your mood now? And after that, you can check inside that, do you agree with me that working under the influence of alcohol would hinder your decision making skills, especially as a doctor when patients' lives are at stakes? So you can check inside, and then also check, have you thought of harming yourself? Sometime when person is very low in mood, they sometimes have bad feelings and thinking of harming themselves. After all these things, then comes the issue of patient safety. You need to ask your colleague, have you ordered any investigations or prescribed medication or discharged any patient today? And are you aware of any significant incident that has happened so far as a result of your drinking? And explain to him that in the best interest of our patients, me or one of our team member will review those patients. Could you please provide me with a list of the activities you have undertaken today? And suggest to him that for the time being, I would suggest that it is best not to remain in the clinical area. So this is patient safety issue. Then E for escalate, it means that you have to escalate the issue. You can explain that don't take it personal, but I am afraid we have to inform one of our seniors about this situation because we value patient safety more than anything else, and that's why we must handle this in a professional way. It will be better if we go together and you can explain your situation to our seniors. You can advise that you can also consult with your educational supervisor for some help. Our seniors will also help you overcome this difficult period. What do you think? And you can also explain that you may be required to have a test, and depending on your test result, you may have an interview with one of the senior managers to discuss the matter further. Remember, we always act in the best interest of our patient. Now, as for support, what is support? Offer support to your colleague about his work. Don't worry, I will take care of your tasks which are left, and it is better to have some days off work unless you feel better. So offer support about his health and alcohol problem. It would be great to seek help from your GP for confidential advice. Gives emotional support as well. If you need somebody to talk to, I would be glad to hear you out. And give advice about traveling back to home, that it is best not to drive until you are under the influence of alcohol. May I ask how you plan to get home? It is better to take taxi rather than driving back. So guys, this is how you deal with a colleague who has alcohol issue. Next is talking to a medical student about his cocaine abuse issue, right? So again, this SIPES approach: seek information, confirm why, mood and risk of self-harm, insight, try to cut down or not, then initiate, patient safety, escalate, support. Again, same important things: good rapport, tell you are concerned and you are not criticizing or judging, offer confidentiality if needed, offer support. Seeking information: thanks for meeting me on such a short notice. How's your day going? How's your life in general? I arranged today's meeting to talk to you about an important issue. I am a bit concerned about you. That's why I am here to talk to you. He asks, what is the issue? Then you can explain that actually I saw you at last night's party and you were probably taking some recreational drugs. I may be wrong, however, by looks of it, I think what you were taking was cocaine. Is that true? I am here to help you. Please be honest with me. Your colleague may deny, may accept. You can further explain that this morning our colleagues noticed that you were a bit agitated and hyper excited. You know, nurses may make a complaint about you to our seniors. That's why I am concerned about you. If he doesn't admit or open up, offer confidentiality and ask him that please be honest, whatever we will discuss will remain within the healthcare system, and this conversation is confidential. It will remain within the system. If he admits, say, I appreciate your honesty, thanks for having trust in me. May I ask how long you have been doing cocaine for? Is there any particular reason why you take it? How much do you usually take? Have you ever taken it during work hours? And it may if affect your decision making skills, and soon you may get addicted to it as well. So then initiate that. Thank you for having the conversation with me, John. I am sure you are aware that cocaine is a very strong stimulant. It results in overconfidence that can lead to you taking risks. Moreover, cocaine can cause some severe medical complications. It can lead to heart attacks, seizures, strokes, coma, and many other unexpected effects. I do not want this for you, and that's why I am here to help and support you in this matter. Explain further that taking recreational drugs will affect your behavior and performance. This compromises patient safety, which is our most important value. Some patients may feel offended because of your behavior and may make a complaint against you. Such behavior is not consistent with the value of good medical practice. This can have a very negative effect not only on your image as a doctor, but also on the image of the medical profession in general. Then you can explore a bit further whether he is dependent on it or not through cage and TDW questions. I will not read these again. You can go through on your own by pausing the video. Right, famish question. Again, check for family, friends support, relationship, any stressors. Ask about alcohol abuse. If yes, explore. Use for other recreational drugs. Check mood. Then explain that do you agree with me that working under the influence of drugs would hinder your decision making skills, especially as a doctor? When patients' lives are at stake, this morning our colleagues noticed that you are a bit agitated and overexcited. Don't you think that it has affected your workplace already? This is to check insight. Then ask about suicidal or self harm thoughts, and ask about hallucination or abnormal thoughts because of taking drugs. So, famish question as usual. Then, patient safety. Again, ask have you ordered any investigations, prescribed medication, or discharged any patient today? Are you aware of any significant incident that has happened so far as a result of taking cocaine? And explain that in the interest of patient safety, me or one of our team member will review those patients. Could you please provide me with a list of the activities you have undertaken today? And for the time being, I would suggest that it's best not to remain in the clinical area. Next is E for escalate. Explain that nothing personal, but I am afraid I have to inform one of the seniors about this situation. It's important to remember that we value patient safety more than anything else, and that's why we must handle this in a professional way. You may be required to have a test, and depending on your test results, you may have an interview with one of the senior managers to discuss the matter further. And this decision is what is best for not only our patients but also for you as well. Support is same about work. Don't worry, I will take care of your work. It is better to have some days off work unless you feel better. About his drug abuse problem and other issues, it would be great to seek help from your GP for confidential advice. You can also consult with your educational supervisor for some help. Our seniors will also help you overcome this difficult period. Give emotional support. If you need somebody to talk to, I would be glad to hear you out. Is there anything which I can do for you? About traveling back to home, it's best not to drive until you are under the influence of cocaine. May I ask how you plan to go home? It's better if you can take a taxi. Guys, I hope you are not tired. So, talking to a medical student who often comes late, Another important Plab 2 scenario, SIPE's approach, seek information, first confirm, ask why, traffic issue, tasks to do at home, sleep problem, playing video games till late night or getting up late. Check insight, then patient safety, initiate, escalate. So coming to again important things, good rapport, you are concerned, not criticizing or judging, confidentiality offers support. Seeking information, how's your day going? How's your hospital posting been so far? Are you enjoying talking to the patients in the hospital? Do you have any idea what I'm going to talk to you about? Actually, I'm a little bit concerned about your timekeeping. I noticed you came late to the ward today. He may say, I am usually on time. I was only late this morning. He may say, I was stuck in the traffic. Ask how about the other days. In fact, our colleagues have noticed that you are coming late quite often and brought it to my attention. If he remains silent, encourage him. There is no need to worry at the moment. May I ask, is there any particular reason why you are coming late? And if he admits, appreciate and say that thank you for your honesty. Is everything okay at home? And try to figure out the reason for coming late. This is very important in this station because in your management you have to give advice regarding that reason. So is there anything bothering you? May I ask how far away you live from here? Do you have some tasks to do before coming to hospital, such as taking your brother or sister to school? Do you work part-time somewhere? How is your sleep? Elaborate sleeping habits, especially partying late night, watching TV or playing video games till late. Then initiate stress, give stress on the importance of good impression, John. As a medical student, it's very important that you demonstrate to all staff that you are capable of coming on time and hence we can rely on you. Stress on don't miss learning opportunity. You will also find that you will be able to learn a lot more if you come on time because the morning ward rounds offer a great opportunity to learn. Then highlight discipline issue. If patients also notice that medical students come late, they may assume that all doctors are careless. They don't come in time and don't learn properly. As a result, patients may lose trust in doctors because they may think doctors are not disciplined. Patient safety issue in this situation is that you can explain, I am sure you know that it is very important for doctors to be punctual and maintain good timekeeping skills. By coming late, we may not be present at a crucial time when a patient needs us, and this can compromise patient care and safety. Escalate in this station is that I think it would be better if you inform your supervisor because if he will come to know from somewhere else, then it won't be good. In the future, if you anticipate any travel problems or if you are unable to reach your place of work in time, it is more appropriate to phone your educational supervisor as early as possible to explain the situation. If you find it hard to get to your place of work because of long distance or traffic issues, you can discuss it with your educational supervisor and you can get a placement in a place near to your house. Then if he is having problem with sleep, then advise make a good sleeping habit, and it is advisable not to play video games before going to sleep or partying late night because it will affect our performance next day, which can compromise our patient's care and safety. And I suggest you should keep alarms. It will help you in waking up early. And then support is that it would also be a good idea to attend a time management training course. It will enable you to manage priorities and schedule tasks more effectively. You can also take advice from your seniors. Anyone at any level, including myself, will benefit from the strategies and techniques discussed in these courses. You can find out more from your educational supervisor. And regarding this matter, if you have any concerns or questions, feel free to talk to me if I can help in any way. And have a good day, John. See you again. So, ladies and gentlemen, coming to our last station, last scenario, talking to a colleague who made a post on Facebook about a patient. Here is a confidentiality issue. Very interesting scenario. Again, SIPE's approach, seek information, confirm why, insight, then initiate, patient safety, escalate, support. Seeking information. Thank you for meeting me on my request. How's your day going so far? I need to talk about something important. If it is okay with you, I just want to ask about a post on social media regarding one of our patient, which you recently posted on your Facebook account. Is that right? I am a bit concerned about it. Did you post her name and other details as well on Facebook? then initiate. I think it is not the right thing to do because posting patient information on social media is a breach of confidentiality. Being a medical professional, we must obey the rules and regulations set by the GMC. Breaching confidentiality can result in complaint to the GMC and legal actions. What do you think about it? Should we look on the internet about the GMC guidance about this matter? What do you say? I am sure you wouldn't have done it if you had thought about the consequences. Patient safety. We should definitely take the consent of our patients if we want to post something about them. You must be aware of the fact that how easily this information can spread on social media platform. Moreover, it can erode public trust on medical professionals and it can hinder us from getting the information from our patient to treat them better. Then escalate and support. I highly encourage you to delete the post immediately. I sincerely advise you not to do it in the future. I would request you to talk to the patient as well and apologize to her for the incident. And it is very important to inform our seniors about the incident. It will be bad if our senior get to know about it from others. Offer support if you want. I can be there with you while you talk with our seniors and we can both explain in a better way. So guys, thank you for watching a long video, a lengthy video, medical disclaimer, and we have reached to the end. For watching, subscribe and press the bell icon and forward to your friends. See you next time and good luck. Bye bye.